Welcome to the Mental Health Today show. My name is John Cordray, and I'm a licensed therapist since 2007. I've had this podcast since 2015, and it's been amazing to be able to meet and talk with other people, professionals on this podcast. And today is like no other. I have an esteemed doctor. He's a board-certified family physician with over 27 years of clinical experience. Dr. Dhruva, and I'm so excited to introduce you to him. And let's hear from him about mental health and what he's doing in his work. Dr. Dhruva, welcome to the show.
Thanks for having me, John.
I am thrilled that you're here. I know you're very busy. And in fact, we had to reschedule our time to record because of your schedule. You are a very busy person, and yet you are making time to come on the show, and I really appreciate that. All right, so let's get into this a little bit. You've been doing your work for many years, and you've had many experiences along the way, I know, because I've been doing therapy for many years too. But I'm really interested in hearing your story before we get into the main topic today. Can you share something with us about what would be a story that really exemplifies you?
Yeah, I appreciate you, John, and what you do also for others to inspire from our journeys to be their best self. And if it wasn't for people like you, we wouldn't have these visionaries like yourself are the ones that help others feel better when they feel like they're alone. So I appreciate what you do too. And I love to make time for these types of things. I feel that this is definitely an inner desire that doesn't feel like work. It's where's the time? You just have to search for the time to make time for these types of things. So I appreciate you taking me on the show, and likewise taking the time. I'm sure that you have a lot going on too. But a story, would you like for me to just...
Yeah, tell us a story about perhaps how you got involved in the work that you do.
Yeah, I'm 38. I got sober July 31st, 2018. I'm 38 years old. I'm walking in from the primary care center to the urgent care center. It's quite hot outside. And instead of wearing my regular gear, I'm wearing a t-shirt instead of the lab coat. And as I'm walking in to the urgent care area, the lights are bright, a little bit more fuzzy. At this moment of time, I was seeing 17 patients a day. I had probably about 70 open charts, 17 treatment requests, and drinking, if I could, 17 drinks a day, doing cocaine 17 times a month. And I sit down across the way from my medical director, and he looks at me and he says, "We're worried about you." I look at him in the eye and I start crying from the left side. Usually when I try to hold it in, I'll have tears come from the left side of my face, whatever. Maybe you as a therapist could maybe elaborate more on that. But in any event, I had a tear come down, and I mentioned to him that I wonder what it feels like to have dinner with a family. And at this time, my self-hatred was at an all-time high, low self-esteem, low confidence. I was in the middle of a cocaine-induced manic episode, and it wasn't just that day. It was brewing over a period of years. But this episode probably was about 3 months, and he walks me out, I leave. After that, I go to the Washington Physician Health Program, so grateful for them and what they do. And then I went to rehab for 3 months. I was off of work for about 9 months, just gathering what actually happened. At this moment, I could have lost my career, my home. I was in about $300,000 in gambling debt, and I was about to file for bankruptcy. I had to figure it out. And you can see some of these public figures, I don't want to name names, but some people are very inspiring who have had problems in the public eye. Correct? Yeah. You cannot it. For example, I think Charlie Sheen had a lot of problems as an example, and now he's speaking about it. Maybe if I hadn't got caught, Or maybe if a bunch of people hadn't have helped me and they believed in me, I would have just kept quiet and had the steady state of the neurobiologic stress cascade, steady state of increased cortisol, quick dopamine hits, decreased serotonin, oxytocin outsourced through external validation, and just that baseline of self-hatred. I would have just lived there, but I had to figure it out. And not only that, John, this is where I appreciate you too. And my EMDR therapist at that time, the Washington Physician Health Program said I had to be in EMDR for a minimum of 2 years. And I was against it. I forget about it. I was against all of it. I didn't want to do any of it. But then I knew that I had to figure it out. And that's where I started developing alchemical awareness. And then after that, the alchemizing the resentments to inspire others. And that's where the journey really began.
I really appreciate your honesty right off the bat here. And here you are, a doctor, been a doctor for a long time, and you're talking about your struggle. And it's a very real struggle. And as you pointed out, it's a struggle it doesn't discriminate. It doesn't matter if you're famous. It doesn't matter if you're a doctor. It doesn't matter if you're rich and famous. These are real human issues and struggles that we need to talk about. And you are highlighting it by saying, hey, I'm a human being first before I'm a doctor. And I struggled and I didn't want to get help.
No.
You admitted that you didn't want to get help.
No.
And that is so common. And you were forced to get help. That's how you got the help. And so I really appreciate that part of your story of just being brutally honest and say, yeah, I'm a doctor. I know better. I went through all the training. I see patients, and yet I struggled and I became the patient. And so just that little part right there, I think can encourage people who are listening to this, that maybe they're on that cusp of, yeah, people tell me I need to get help, but I don't want to get help. I just want to do my own thing. And maybe next year I'll get better. It doesn't work that way. And so getting the help, being intentional and going to therapy is what's going to help. And that's exactly what you said. So thank you for that. All right. You went through those years. You went through the EMDR treatments. You got sober. And then what happened next?
So exciting. Maybe we can make it simplified. It's 6 a.m. You wake up and you hit the snooze button. Right away, there is a resentment that develops. Should I have done that? There's the cortisol fatigue, the decision fatigue. Should I have done that? Should I have not done that? And then you look at your phone, maybe looking for an email or a text, or let's say you're dating somebody, or whatever the case is, you're looking for something specific. You want an exclamation point, an emoji, or some type of a response. You don't get that. It's not even 6:01 a.m. and already you are in a resentment implicit bias. That resentment implicit bias carries over by fixing and overcoming the emotions around it. It can be very simple. I didn't get the response I desired. I have a resentment. The resentment is typically towards yourself, but then the neurobiologic stress cascade, the hypothalamo, pituitary, adrenal, sympathetic nervous system activates. Cortisol increases, you get a catecholamine surge, and then heart rate, blood pressure increase, cortisol, increased inflammation. Now you're in a full limbic hijack. And it's not even 6:01 a.m. yet. It's not even limbic static. It's not emotional friction. It's a hijack. And then you got to quiet that down. I'm going to text them back like this. I'm going to send that message. How dare they? And then you feel rejected. What happens is that to quiet this whole scenario down, you need some dopamine hits. Let me scroll, let me drink, let me drug, let me complain, let me blame. And these things carry over a period of a lifetime. And at 6:01 a.m., you're going the whole day with that resentment implicit mind, where somebody's against you, somebody's saying something to you, some type of victimhood, some type of blaming, something that's not within your core values, and that inflammation increases at the end of the blood vessel wall, atherosclerosis, heart attack, stroke. And then people come see me after all of that. And this 6 to 6:01 a.m. can translate from when you're younger to when you're older. And growing up with my mom, my dad, they were immigrants. I had a very intimate relationship with Child Protective Services, Adult Protective Services. My dad would beat me, make me hit my mom. I went to juvenile detention multiple times. My brother would wound up being found dead for 17 days from alcohol and drugs. And then my mom was schizophrenic. She was institutionalized for 27 years with schizophrenia. A lot of these things that happened with that cocaine-induced manic episode had nothing to do with the present day. And if you want to wake up with that empathic implicit mind, or what I call neurospiritual sovereignty, there's no way around it. You have to write it down. And that's what mind hygiene is. You just keep on writing and accepting the emotions around it, understanding why it happened, alchemizing those resentments. And then when you wake up at 6 a.m., you don't hit the snooze button. You have respect for yourself. You believe in yourself. And then you have that empathic implicit mind, or what I like to call also limbic immunity, where you have this emotional frequency where you're just not dependent on somebody else's validation. You understand yourself, you're consecrating or surrendering those resentments in real time. And thereby you don't drink, you don't drug, you don't complain, blame, talk bad, and you don't get a heart attack and stroke.
Yeah. Yeah. There's a very strong connection between mind and body. It's not one or the other. And when one's out of sync, the other is going to be out of sync. It's going to notice. Your body is going to notice when your emotions and mind are not in sync. Your mind is going to know when your body is not in sync. You cannot have one without the other. And you said it very excellent. You mentioned mind hygiene. So I want to press in on that a little bit. You mentioned mind hygiene. What exactly is that?
Mind hygiene is an evidence-based writing process where you believe in yourself every second. You're in emotional isolation, life tragedy, addiction, you're alone, you don't have anybody to depend on. Mind hygiene is a concept that I developed in my 11 years of monastic solitude, writing and rapping about what can I do to feel better about myself when nobody's there. And the thing about mind hygiene is that there's no time off. You want to believe in yourself. I would say that there's a mind hygiene study that I conducted for 4 years. It was a non-IRB retrospective study, which found that patients who wrote from 1 to 90 seconds every 90 minutes, of course, it would increase. And an example, since we're here, is something like this. I'm constantly doing something.
If you're listening to this, he's showing something on the video. Just so you know, if you're just listening, you can go to the YouTube channel and watch it so you can see what he's doing. Tell us what you're doing there so that my listeners can know.
Yeah, and what I'm doing here at this moment, it's what I call basal ganglia integration, or in the habit center. It's so integrated into my mind hygiene or whatever writing process it is, because they're all evidence-based. Oh, get my cat out of here. Yeah, writing has evidence to support it. So as I was saying, with mind hygiene, in the study, patients wrote on paper or on a dry erase board or on an easel pad. And as you kept on writing and using the framework of mind hygiene, which is ACE is your life with mind hygiene. A is accept your awareness, communicate your compassion, C, embrace your empathy, and S is soften the process. And this is where you just accept the emotions around whatever it is that you're feeling. 6 a.m., you have that resentment, accept it, and then write about it, empathize with it, understand that it may not have anything to do with the present day, and then you can make an appointment with John and soften the process and not make it seem like it's hard. And understand that it's like doing push-ups or doing pull-ups or doing air squats. It could take several months to years for you to actually develop that core musculature of the mind. What David Goggins says, callousing your mind. It could take so much time, but if you don't believe in yourself in the process, then nothing is going to work. The sport of thinking could be one of the most difficult if you make it to be difficult.
You're absolutely right. It's so many people that I talk to really struggle with overthinking and the catastrophizing. I call it thinking traps or cognitive distortions. And they make assumptions. And those assumptions are not always accurate, or they're not always true. You don't have evidence for those. And yet they go about their day as if it is true. They believe it and turns into a false narrative. And so I really like your approach on the mind hygiene because it's intentional. You have to be intentional with everything that we do, but you have to be intentional with your thoughts and with your mind. And that is a key here, I think, for people who are really struggling with their mental health, whether it's addiction or not, to be intentional with the thoughts that they're having. And what you mentioned, that this program that you developed, Mind Hygiene, does that. It helps people, it guides people to do that. So I think that's fantastic that you have this. Tell me more a little bit about is it a program? Is it a journal? Or tell my audience about how can they get involved in this or use it for themselves?
Yeah, you want to be at that place where we're just using the text message as a very simple example. At 6 o'clock, you want to be the person that wakes up with that neurospiritual sovereign mindset. Your neurobiology is not tied to how you act during the day. Not like you're controlling your emotions, because mind hygiene goes against that. And if controlling your emotions works for you, I wouldn't listen to me. If whatever you're doing works, this is where mind hygiene becomes exciting. If you want to feel that emotional freedom, you want to have that self-belief that you don't need something else, or if something else does come into your life, that it's not going to affect you where you don't live within your core values, then writing is the way to go. And that's the exciting part about mind hygiene, is that you don't need mind hygiene to believe in yourself. You can use any writing technique. Writing has so much medical evidence to support it by decreasing immune function, engaging the prefrontal cortex, writing what you visualize, and then introducing it into the habit center, the basal ganglia, and then forming that day-to-day sovereign approach to your emotions, and then decreasing those hits on the amygdala, that emotional brain. And the more you keep doing it, the better it is. You could think about that text message as the heart attack. Do you want to prevent that? Or do you want to use an evidence-based writing process? Mind hygiene could be one of them. Or you don't need me. You don't need anybody. You don't need a family, a friend. You don't need a coach. You can inspire from these people. But the thing that's, for example, with EMDR, I was rapping and writing after my sessions over and over again. Sometimes memories that you have, you may need to write them a few hundred times over the years. And people are like, that's too much. Do you want to eat bad a few hundred times and have a heart attack? Do you want to drink bad a few hundred times? And that's where I'll maybe, to cap this segment off for this mind hygiene part, would be neurochemical consecration, where whatever it is that you want to do to stabilize your neurochemicals, you're never going to want to do it. When I drank, I drugged, I gambled, I was addicted to sugar. I didn't want to do it. I just did it anyway. I didn't want to go hang out with a bunch of people that talked crap about others. I just did it anyway. If I didn't want to jack cars when I was a teenager, I just did it anyway. And I didn't want to study in medicine. I just did it anyway. So that's the way I viewed this as well. I want to be free. I want to be emotionally free. I don't want to depend on anybody for my validation and my self-worth and my self-belief and self-respect. This is what I'm going to do that. And I'm just going to keep on doing it. And this now is so ingrained, I don't even know. And I have a dry erase board here downstairs and a vision room upstairs. And then I have an easel pad here as well. Now I'm constantly writing. If it wasn't for the writing, I would be completely lost. And I was writing before the cocaine-induced manic episode, but then the writing became more intentional, purposeful, and I realized that I can inspire somebody perhaps one day with the story. And that's the essential part of mind hygiene. It's writing your way out of self-hatred to self-love.
I love it. So many people are self-hating themselves so often, and they live in the regret. They live in the rumination of the past. And what you're talking about is we can't control or change our past. Your past was traumatic in so many ways. You can't change that, but you can work on how you view that now. And it's a very powerful thing of writing. It sounds so simple, but it's so powerful. I tell this to my clients all the time. Writing it down. There's something magical that happens when you write down what's in your mind, in your head, and you write it down. on paper, whether it's a journal or whether it's just a piece of paper. You're being intentional and writing it out. And that is fantastic. And through the process, as you mentioned, you learn to love yourself again. You learn to have compassion on yourself again. So many people who hate themselves would say that they love others. They can have compassion on other people. But when it comes to themselves, not so much. That inner critic comes out. And they live with that. And you're trying to bring out the emphasis of writing down in this mind hygiene that you mentioned. It's a process. It's a way to do it, but it's not the only way.
Yeah. Yes, definitely. You don't need me. I always mention to my patients, if there's one piece of advice that I'll give you is this: don't take advice from anybody. You got to write it down. You got to understand. Don't listen to me. You can inspire from my story. In patient rooms, I always like to say, we're just going to talk stories here. I'm not going to tell you what's good for you. I will never tell a patient to go on a diet, exercise, or fix your anxiety. But what I will say is this: who you want to be. If you don't, then 1 to 90 seconds every 90 minutes for life at a minimum. And of course, you can shift that at some moment. But if you even take 1 day off, it's gone. There's no time off. But it doesn't mean you need to do anything grand.
Yeah.
And it's just one way to view it, of course. If other people are doing things to be emotionally free, to be in that neurospiritual sovereign mindset, and have that empathic, implicit mind where you understand, you have compassion for yourself and others, as you were mentioning, that global compassion instead of the performative. I need to be nice. No, I'm just nice to myself. I tell patients the times I stopped judging myself is when I effortlessly stop judging others. Yeah.
I like that. And I think that is an obstacle, that just the self-hatred is a profound obstacle for so many people. And whether it's perceived or maybe they've been told that they are bad. And I see it in my practice every day. I see it in my clients. And they have fallen into the belief system that there's something innately wrong with them. Whether it's perceived or maybe they were actually told that when they were a child. And that's hard to get over sometimes, but it's so critically important to work through, as you're mentioning. So how would you say inner clarity fuels compassion? How does that fuel compassion in service?
Yeah, I'm 8 years old. My dad is standing over me, pointing his finger at me, saying, "Who are you? Who do you think you are? You're just a stupid little kid. You don't know anything." And who knows what happened after that? Did Child Protective Services come take me? Did the Seattle police, the Juneau police, were they there? Who knows what had happened, because it was so repetitive. But it's interesting that we can take that and zoom out and see what he was thinking. Why was he doing that? Forget about how I felt. Forget about what I felt, because I truly believe that at the larger scheme of things, to prevent that inflammation, that heart attack, that stroke, consecrate cortisol and what I call dopamine devotion or dopamine delay. To do that so you prevent that heart attack and stroke is to forgive yourself for the things that you did to other people. What happened was that my dad did that to me. I did that to somebody else. So those narcissistic traits I displayed on other people to feel good about myself, that were maybe beneath me or weaker than me. When I said that I hate myself, I had low self-esteem, low confidence, and I was a narcissist, that was the best thing I could have ever said. Because now I finally love myself because I accepted it. That's the core part about mind hygiene, is you just accept it. There's nothing to do. You don't fix or control it. But if you can understand what was my dad thinking at that time, pointing down at this young boy with his finger saying that you're stupid, is that he hated himself so much. A lot of the times narcissistic traits, as you can probably elaborate and maybe educate us and me, is that the narcissistic traits are complaining, blaming, victimhood, and being condescending. Whereas narcissistic personality disorder has a DSM-5 diagnosis. My dad had that. So whenever I feel, or if I feel the frequency of somebody with the personality disorder where they don't have insight into it, I can feel it right there. And I get a little stimulated. My dad did not, I truly honestly believe he didn't know what he was doing. His dad did that to him. He didn't know any better. My dad was gay. He didn't accept it. He had filed for bankruptcy. He was an immigrant, came to America, wasn't successful, and he took that out on me. That's just the scope of things that I learned through eye movement desensitization, reprocessing therapy. But see, I've done cognitive, I've done dialectical, rational emotive, metacognitive behavioral therapy, mindfulness-based cognitive therapy, which is one of my favorites. And then MBSR, I have a course completed certification in mindfulness-based stress reduction. But it's the writing that really helped. And when you write from his perspective, you're like, when you write, you're doing something you don't want to. When you eat healthy, you do a push-up, you don't want to do it. That's self-compassion. But when you've developed the self-compassion, you don't want to think from his perspective, you just do it anyway. Now your compassion outwardly is not performative. You have inner clarity. You realize, why is it that I said somebody was stupid? Why did I do that? How dare I do that? I didn't do it because he did it to me. It's because I didn't understand myself and I needed to forgive myself. And that's where the focus is completely taken away from everybody else. And those narcissistic traits of the victimhood, the blaming, complaining, all dissolve automatically.
Yeah. And you cut off the cycle right there.
Yeah, you're understanding his perspective. Yeah. What did he do? Why did he do it? But then at a high level, though, over and over again, hundreds of times.
Yeah, exactly. At a high level, a good example might be asking yourself, why did my dad say that? Why did he do that? Instead of pointing a finger at you, it's because I wasn't lovable, or I did something wrong, or I just wasn't good enough. No, it's trying to understand the real heart of the issue. It's probably his pain. It's trying to really think about the other person's motive and actions and behavior instead of pointing the finger at yourself. He did it because I'm no good. He did it because he was hurt.
Yeah.
That's transformative. And that can really lead to just a release of built up anger, built up grudges, to be able to look at someone's behavior and it hurt you profoundly. But for you to be able to say, yeah, I was hurt, but it wasn't because of me. It was because of their hurt and pain. Therefore, I forgive them. That is transformative. And you're saying be intentional with that and write that down.
Yeah, and I've done that in many of my keynotes where I've written from his perspective. What was he thinking when he wanted me to fail medical school? Why is it that my dad, this is one part of the journey with him. When I'm walking downstairs as I'm going to my final year exam, my dad said, I hope you fail 20 times. 24 years old, I started crying. Somehow I passed anyway. But why did he do that? It's because he wasn't successful. He blamed himself for certain things. He doesn't want somebody else to be successful. However, with the personality disorder, I believe that he didn't know it. And this is just maybe a different viewpoint, a different perspective, but I never tried to forgive him. I was only trying to forgive myself. But in that process, what I call forgiveness in motion is empathy. And when I forgave myself, I was automatically able to forgive him. I didn't even know it. I didn't know that I forgave him. I'm like, okay, I get why you did it. It's because I hated myself. I didn't like myself. I displaced my fears on somebody else. My overconfidence was directly proportional to low self-esteem, low confidence, self-hatred. I knew that by writing it. I accepted it. So what? I've accepted it. What's the big deal now? I might as well just do something with it. And that's what happened during those 2 years after that cocaine-induced manic episode. I knew that this fixing, the controlling, blocking things out was not going to work anymore. And that's where I developed that acceptance, that self-compassion by writing. And it's just one of the things. I don't eat sugar anymore. I don't complain. I don't blame. I don't talk to people that do. The monastic solitude I've been in, the urban monk life for about 11 years, where I've just depended on myself. So some of those things have also helped. I do believe my life is designed for a higher purpose. And that also helps as well. And the Mind Hygiene study showcased that. And many studies showcase purpose. Is that if you don't have a purpose in this, if my purpose was to keep my job and my mom was living with me at the time, I had to figure that out. But then I realized I think that there's more to this than just keeping my job and having everybody like me.
Yeah.
What a tough day. What a tough time trying to have people like you. Oh my God. Oh my goodness. It's such a tough day.
Thank you for the sharing the story. And obviously, you are a good example of turning your hurt and pain into helping and healing. And I think it's phenomenal. Keep doing what you're doing. And this is a message that many people need to hear. And it's a message of hope and transformation in a world where we don't get a lot of that. We don't get a lot of encouragement for hope or to transform ourselves. And so thank you. And I appreciate that. Is there one last parting word of advice or encouragement that you would like to leave my audience?
Yeah, when you look at some of my before and after pictures of when I was in juvenile detention, when I was 60 pounds overweight, when I was 15, 20 pounds underweight, when I was doing drugs, and just the identity transfiguration that took place is possible for others. The before and after pictures that I have are it's not only an indication and an inspiration that things are possible. I have videos from that time and witnesses as well. Now, I don't want to make the story about me, but what I'm saying is that if you take a before picture now and you undergo that identity alchemy by writing, stopping things, I always like to say, if you quit everything, sugar, carbs, fatty food, complaining, blaming, and then write, anybody can do what I'm doing. You don't need me. But you take that before picture, you say, what is it? Accept it, write it down, keep doing it. And then you can imagine or visualize or manifest that person that you want to be and step into that identity. And when you undergo identity transfiguration, your neurobiology will shift automatically. You won't even know you're doing it. Mm. And that's what I want to inspire people to do, is not to have that performative identity. You're going to have lag, of course. I was eating sugar, I'm not. I wasn't doing push-ups, I am. Instead of you just come home and I'm just doing push-ups before I take a shower because I didn't have time to go to the gym. I don't even know I'm doing it anymore. You can get there as well.
I like that. Yeah, that's awesome. Where can someone, obviously you have a lot of information, you talk about this a lot. If somebody wants to learn more from you in what you're practicing, where can they go? Can you let us know your website?
Yeah, you can log on to dhruvamd.com. That's DHRUVAMD.com. And you can scroll all the way to the bottom and you can get onto the Mind Hygiene mailing list, where we talk about believing in yourself every second when no one is watching. And then you can view my story and see how you can inspire from it as well. There's a link to the Mind Hygiene study as well, where you can download the white paper.
Fantastic. And I will put all of that, your link to your website, in the show notes. So if you're listening to this and you're wanting to go, so just go to mentalhealthtodayShow.com and you can find this episode and look at the show notes, and all of that information will be right there. All you got to do is click on the link. All right, my friends, that is all for today. Thank you for listening to the Mental Health Today show. And it's been a real pleasure bringing this episode to you. And I hope you're working on yourself. If this resonated with you and if you could identify with what we talked about today, I really want you to encourage you to go and check out this work, the Mind Hygiene. And if at the very least, start working on you. Take care, my friends. Until next time, bye-bye.